The results of a 5-year government Medicare experiment are now in, and well, they're dismal, the results. The experiment, which is considered a forerunner to some of the cost control rules in Obamacare, offered financial bonuses if hospitals or healthcare systems were able to cut costs and better organize care for Medicare patients. But guess what? Few ever saw that money. Here to weigh in is Dr. Sreedhar Potarazu. He is president and CEO of Vital Spring Technologies and author of Get Off the Dime, The Secret of Changing Who Pays for Your Health Care. Doctor, welcome.
Thanks for having me back.
Yeah, it's great to see you. So this is a little complicated. So I want to start with having you explain what an accountable care organization is and why the Obama administration thinks this is a good idea.
So the accountable care organization model is what's going to kick in January. And it's the new wave of managed care where there's going to be a bundled payment for doctors and providers to take care of a single patient in order to drive greater efficiencies in terms of cost and quality. And the idea is that by weeding out some of these inefficiencies and creating a bundled payment within these ACOs, that will be able to save a lot of money. And that's the underlying premise under which the law was passed, with the idea that these ACOs would be the means of how we're going to save billions of dollars.
Doctor, I mean, the reality is we tested this for 5 years. Didn't really work.
It didn't work, and it actually gets worse than that. Not only did it not work, but in fact, the cost incurred by these hospital systems or the doctors was enormous. And if you look back last year in terms of what we were sold on, the projected savings by 2019 of over $50 billion in Medicare costs by improving efficiencies through this kind of model, what wasn't factored in, not only does it not work, but the bigger question is how much money has to be spent, which was the big question these hospitals had in order to measure the efficiencies.
All right, let's break this down a little bit because we got a lot of ideas coming out here at the same time. I think your first complaint with this model is that the hospitals, the healthcare organizations have to pony up a ton of dough to make it happen. So they have to put in an upfront investment. They may or may not be willing to do that, correct?
Well, they don't have a choice in terms of whether they want to do it. They have to do it. It's a pretty substantial investment, and the investment to put this technology in, whether it's electronic medical records or just bringing that data out so somebody can measure efficiency, wasn't factored into the cost of the law. So it's really not a $50 billion savings. And if you look at, all of the stuff that you've been talking about earlier in terms of the deficit and spending, it's really worrisome to think that not only are we not achieving savings, but we've got to spend more money to get there.
Well, Obamacare was sold because it was going to reduce our costs of health care. This is yet another example of how it does just the opposite, in fact. And these expectations that Obamacare is going to pay for itself, true or false?
False. The way that it's set up right now is absolutely false because we have no mechanisms in place to, in fact, measure efficiencies. And what we've sold people as the down payment we have to make to get there is completely false. And so we've sold people on a bill of goods that has no basis whatsoever. And the proof is in the pudding for the study that came out today. You have very few hospital systems that in that model actually save money. And it gets worse because come January, these companies, even though they had to spend more, weren't penalized. Come January, if you end up spending more than what is allocated to you, you actually pay a penalty. So it's not just getting a bonus for doing well. You actually get a slap on the hand and actually owe them money if you end up spending more. So it's actually worse.
Boy.
I know.
Look, the more I see of Obamacare, the more I'm shocked about how it's already changing the landscape of healthcare. What do you see in your practice?
Well, I'm not practicing medicine at the moment, but I'll tell you that what I see from various aspects of those that are practicing and from those who are paying for health care is that, as I've said time and time again, waiting times are increasing. Access to the health care system is getting obviously a lot more difficult. Premiums are going up, so people are spending more. Nothing is going down. And ultimately, there's a lot of frustration in the system in terms of what's going to happen to the quality of care that you and I are going to get delivered. And this is a consistent message that I've said time and time again. And today what you see is that we've tried to put in place this new wave of managed care, and we're going to go back to the 80s, where people are going to wait a lot longer in terms of getting the tests that they need. And maybe this was the intended result, but unfortunately we're going to go to a system where the quality of care is going to diminish. It may be great that we're providing, some people with insurance, but that's really a fallacy that insurance is going to be a proxy for them actually getting the right care, because it's not. And here we spent...
Coverage may not mean as much. That's for darn sure.
Coverage is not, it's going to be meaningless. And here we've written a ticket for close to $1 trillion on the brink of Moody's downgrading us now because we can't bring the deficit down. I think we need to start with a clean slate, and we need to start over again, because clearly this current law doesn't sell, what we've been all told last year, that it's going to save anything.
All right. Dr. Potarazu, thanks for your help today, explaining a very difficult topic. Appreciate it.